Good morning. I'm Dr. Gunzenhauser. I'm the Interim Health Officer for Los Angeles County. First, I just do want to affirm that there are no suspected or confirmed cases of Ebola in Los Angeles County. Yesterday, New York City announced that a physician, an emergency room physician who had been providing care to patients with Ebola in West Africa and who had returned to the United States, has tested positive for the Ebola virus. So today I want to provide an update to you about our continuing efforts to assure that the public is safe here in Los Angeles County and what we are prepared to do in case a case should occur here. So first, I do want to reaffirm that there are no suspected or confirmed cases of Ebola in Los Angeles County, and if we do have a case confirmed here, we will let you know. I do want to assure the public that I have high confidence in the ability of our county to respond in the event that a case occurs here. I think it's very important to note that among the 4 cases that have been diagnosed in the United States, 2 of these occurred in individuals who had traveled recently to West Africa, and the other 2 individuals occurred in healthcare workers who were providing care to an individual who had Ebola. So no members of the public who haven't traveled to West Africa or haven't been involved in the care of a patient with Ebola has been infected in the United States. Our efforts to ensure the safety of the people of Los Angeles County are continuing. We're continuing to work with healthcare workers and hospitals to assure that they're prepared to rapidly identify and contact us in the event that they suspect an individual may have Ebola. We're also actively engaged with a number of hospitals to assure that they're prepared to isolate and safely provide care to an individual who may have Ebola. A couple of events have occurred in the past week that I think are very important to highlight, as these events really augment our ability to assure the safety of everyone in Los Angeles County. The first of these is that a few days ago, the Centers for Disease Control and Prevention released new guidelines on the wear of personal protective equipment by healthcare workers who are providing treatment and care for individuals who may have Ebola. The new guidelines emphasize 3 key principles. The first principle is to assure that all workers who are involved in the care or contact with potential patients have training in the use of this personal protective equipment. The second principle is that we want to make sure that the personal protective equipment covers all body surfaces, so there's no unexposed skin. And the third principle is that when individuals are donning or doffing personal protective equipment, there should be a safety monitor who's observing them and assisting them as they put that equipment on and off. These new revised guidelines are based on lessons that I've learned from the experience in Dallas, and the Centers for Disease Control is putting these out as an extra safeguard for our healthcare workers. We're sharing this new information with hospitals and other healthcare organizations in the county and assisting them in their exercises as they train their workers in these new guidelines. The second major advancement that occurred this week is the implementation of a new program to actively monitor all persons who are arriving in the United States from Ebola-affected countries. This approach, which is multi-layered, has 3 key elements. The first key element you've heard about, which is the exit screening that actually occurs in West Africa for travelers. So they're checked for fever and asked about their exposure before they leave West Africa, and if there's any symptoms present or any concern, they would be deferred from that travel. You also heard that last week 5 U.S. airports in the United States began what we call entry screening for travelers who are arriving from West Africa. This involves fever checks, taking a history of their symptoms, and reviewing their travel. If any individual has symptoms, they're taken aside for a more thorough evaluation by Centers for Disease Control staff. I understand that hundreds of persons have gone through this evaluation, and to date there's been no cases of Ebola identified in those travelers. Recently, the Department of Homeland Security implemented additional measures to assure that absolutely every traveler coming from West Africa is arriving through those 5 airports and undergoes that screening process. The third layer of protection for travelers arriving from West Africa involves collecting information on all those travelers who've passed through those first 2 elements and will be arriving at other destinations in the United States, and sharing information on those travelers with the states and eventually the local health departments so that we can actively monitor all individuals who are arriving in the United States from West Africa. So what that means is that here in Los Angeles County, we are being notified by the state of California, the Department of Public Health, about any traveler who's arriving on a flight that has originated out of West Africa, and we are actively monitoring those persons to assure they don't develop Ebola, and if they do, to assure we provide them safe care. In addition to this, I do want to re-mention that we have a county-wide task force that is meeting weekly and working together to identify specific issues that need to be addressed by Los Angeles County, and to assure that in the event we have a case, we are all actively working together and on the same sheet of music.